Assalamualaikum warahmatullahi taala wabarakatuh, and a very good morning to all participants. All right, hopefully all of you had a good rest last night, perform Solat Tarawih, and I also hope that all of you in good health. Okay, so for today's session, we are going to settle our activity 3 before we move to this topic. Okay, all right. This is just today's activity. Okay, we're going to settle the activity 3. Can you see the slide? Can you see the slide?
Yes, doctor.
Yes.
Okay, thank you. Okay, yesterday we end with activity 3, where you have to discuss different disabilities and the different ways to teach about cleaning stand. Stand cleaning themselves, and you have to come up with teaching method how to teach cleaning for themselves. Okay, then what is the difficulties that they might face and how to modify? Right. Okay, let's start it. Anybody want to present first or to volunteer? I think yesterday I called a few names, but I cannot remember who is that person. Okay, can I have a look the presentation of Mr. Absal Madarhara? Mr. Absal, you here? No. Okay, anybody want to volunteer? Can I have maybe from Philippines, Catherine? How about Catherine? Can you share with us activity 3? Catherine?
Yes, doc, I'm here. Just wait for a while, doc. I will get my hand on my slide here. I can't find it. Doc.
Wait. I have to stop presenting, right? Okay, wait. Stop sharing.
Just wait for a while, doc.
Okay, go on.
I'm just looking for my slides. Yeah. That special educational needs children on how to clean themselves. We have here a name. So it means
Can't
that
hear your
you
voice.
have to,
Can't hear your voice.
can you hear them?
Okay.
Can you hear me now, doc? One is to develop a routine. That you have to do a routine every day to tutor your child, to the special child, on what to do every day. And number 2, we have to create a morning schedule. So, for example, every morning you have to make what to do. For example, after After you wake up in the morning, you wash your hands and then go to the bathroom or brush your teeth. Then next, create an evening schedule. So here, in the evening schedule, you have arranged your beddings or before you sleep, know on what to do before you sleep. You have to arrange bedding. You take you take a bath and brush your teeth. And then number four, give your child a choice of products, textures, fragrances. So child, so before going to the bathroom, the child must have the must have to choose whatever products they want. For example, mga soap or mga liquid soap, shampoos, etc. And then number five, give the supply near one another in the bathroom cabinet. So before inside the bathroom, you have to arrange all the supplies which is reachable to the children so that they can easily reach it. Then with label, of course. And then, um, but before that, you have to introduce to them um, what product to be used before. For example, if they want to take a bath, you have to choose shampoos, the name of shampoo, and the soap or liquid soap or anything that is to be used in or whatever. Number six, name supplies in order of use. Have to name the supplies and arrange it in order and not in order. And then number seven, make a self-care book. You have to make a self-care book, of course. You have to log it or you have to write it in a book stating all what to do. For example, of ng like now before you when you take a bath, what to do first. You have to pour water and then apply soap and then create a booklet with step-by-step instructions with photos and supplies needed. So that's it. So number seven, you have to make a list on steps to do before you take a bath or wash your body. That's it.
Okay, thank you, Catherine. Meaning that this is a general, meaning you do not specific any disabilities here, is it? It is a general way to teach about. Okay?
Let's go.
Yeah. Okay, any comment from others? What is the modification that Catherine suggests here? Anybody?
Good morning. A
Morning.
child with Down syndrome. I'm teaching children with Down syndrome on how to teach themselves.
Okay, Down syndrome.
So we have here different ways to teach about cleaning themselves. First, we have the modeling. An adult must show and physically prompts the child on how to clean themselves using different cleaning tools and toiletries so that they can follow. So demonstration will do by the teacher or the parent in their house, teacher in the school. So second, we have the social stories. So let the child watch the social stories about the desired task you want to do and incorporate it in his timetable, the IEP, individual educational plan of the individual child. So more so, talk to them the importance of grooming or task you wanted them to do. Next is video clips. Let them watch the step-by-step procedures on how to clean themselves properly or desired task you want for the child to do. So we have here the difficulties that they might encounter when cleaning themselves. They might overuse, waste, and steal cleaning materials like soap, shampoo, and etc., as they don't have the strong control when using it. Next, They might poison themselves by tasting the cleaning materials out of curiosity. Will get hurt as they are not oriented or used to using the cleaning tools. Since most of children with Down syndrome have poor eye-hand coordination, so they might start an accident to themselves or to others. So we have here now the how to modify those activities to teach children with Down syndrome, and it can also be used to other disabilities. So we have using a non-sharp or elastic cleaning materials and non-toxic toiletries. Next, we also have use environmental prints and hazard signs. Of course, we have to introduce the child with pictures about the different environmental prints so that they can be familiarized with those. Next is setting routines and prepare things in advance. Last, provide enough toiletries whenever doing the cleaning, grooming time in the morning, and at night to avoid spoiling wasting. So, to end, Elsens need to shield with love, respect, and boost their potentials to the fullest as possible. Thank you.
Okay, thank you, Catherine. It's a very good explanation about the notification that Catherine has. Now, okay, numbering of the things that Sen have to use need to use is very idea. Okay, you know that after before cleaning themselves, first what she have to take. Let's say she have to open the shower first and then take the soap, just numbering all the things that uh, she is going to use. Okay, okay, thank you.
Yes.
May I have one more?
Assalamualaikum Dr. Alija.
Yeah,
I'm Nur Humaira. I'm a teacher from
Humaira, okay.
Putrajaya.
Rajaya,
I
okay.
have with
Thank you,
me,
Humaira.
and I have with me your ex-student, Nur Hidayah.
Hi.
One
You
of,
remember
one,
me, Dr.
one of your ex-students.
Hidayah. Batch aku.
Hidayah?
Yes.
Yeah. Oh,
Yes.
nice
Okay,
to
Dr.
see you. Nice
We'd like to share our notes. We would like to add something from because wait, I need to share this our presentation first.
Both of you in school now. In
Yeah,
Yes,
yeah,
yes.
we're in the same
Okay.
school.
Nice to see you.
All right, so see, this is what we came up with yesterday.
Mhm.
Can you see our screen?
Okay.
Okay, boleh.
All right, cannot share. All right. Okay, so we like to add something that just now you asked about how to cater to students who are on a wheelchair. So we have it here. We can create a child-friendly washroom so that we can prepare a low shelf for them so that they can reach all the stuff while they're on the wheelchair. And also we need to create a washroom with an anti-slip floor. So it's a child-friendly washroom for the kids who with special needs.
Accommodation
Using
for shelf, is it?
oh, ada.
But the ways, and the one has not been mentioned is we can use and to some of the students who are born with special needs, who has autism. They are technologically advanced, so we can teach them to use apps so that they can be reminded of their routine. For instance, here we have listed some of the apps that they can use. For example, Kids To Do List, Photomine, and iDo. So they can use this app to remind themselves of their routine that we have established for them. That's all that we want to add.
Okay, remove your slide. Remove your slide.
Okay, I'll stop. Okay, all right.
Okay. Okay. How about others? Do you satisfied with the modification that Humaira's group suggests, which is suitable for fee, kan? Alright. Okay. Meaning that the accommodation made inside the toilet itself, so that child-friendly washroom, you suggest. Low shelf, anti-slip floor is very important. Also for the others, not only for the self, right? Okay. Measure soap and shampoo. Okay. Right. Then
I need to stop.
okay.
Cannot
Very good.
find
Thank you.
what.
Any other comment or any other suggestion or any to this that Myra School suggest?
Stop. Stop. You're sharing.
Oh, okay.
Okay, one more presentation um from Indonesia before we go to our topic today.
Morning, Dr. Alia.
Yeah.
Yeah.
Ayu.
I'm Anggia from
India.
Indonesia.
Sabrina from Indonesia. Thank you.
Yeah. Okay. I will share the what we discussed yesterday.
Yeah.
Okay. This is what uh we discussed.
Okay.
We discussed it from different disability like blind impairment, autism, hearing impairment, and intellectual impairment. How to teach them is for blind impairment. We need instructional media like audio media or doll which have real anatomy, so they can touch it and knew it. And for the autism child, we're using visual media like poster or video content, step by step how to clean themselves. For the child who have hearing impairment, the she or he have experience when the teacher have the student crying and panic because the period. So the teacher invite her uh, to the restroom. So it's a personal approach. Then teach how to use the pad and clean the pad. So it's using a personal approach and uh, demonstrated directly. And for the intellectual impairment, the teacher teach them with different method. Maybe from Indonesia can help me to explain it more. For the general is we need the visual media. Exclude for the blind impairment, we need audio media or the real how it like doll or something else. And the difficulties for the teach them is when the parents didn't collaborate with teachers to taught disability child about this. It's the difficulties for the teacher. So when the student taught in the classroom, but in their home, the parents didn't taught them, or the parent have a mind that is still taboo to thought about sexuality or clean themselves like this. Okay, thank you, Miss Alia. I thought that I can share for the Indonesia.
Yeah.
I'm sorry if I can explain it more.
Okay,
Thank
remain
you.
in a while, your slide. Okay, India had its type disabilities and the modification and the method that check how to handle. Okay,
Okay.
and this is the it's blind same with blind impairment. We have to forward their audio because they cannot see. So you is very good tools to use to educate them. Okay. Yeah, autism also there are so many technologies to teach autism. Okay. Hearing impaired. Okay.
Okay.
You also have the experience in school, is it? Okay.
I'm not a teacher. I'm in a government. So maybe the teacher from Indonesia can explain it more to share their
Okay.
experience.
Okay. Then intellectual impairment. 2 months to make my students understand the difference of men and women. Okay, 2 months is still fast, quite fast compared because intellectual impairment, normal, sometimes we need more than 2 months to explain, especially about everything. Okay,
Yes.
so thank you so much. Maybe I can call another one more last presentation from I think we have from Brunei. Oh, four of you from Brunei. Huh? Ezra, Muhammad Faizal, and Diana. Okay, please present.
Hello.
Hello. Yeah. Who is going to present? Who is going to present? Okay, never mind. Take the slide. Okay, discuss different disabilities and the different ways to cleaning themselves. Right. Okay. There are three difficulties here: autism, cerebral palsy, and cancer. Okay. For autism, task analysis, visual schedule, modeling, social stories, play game, parents involved. Both also, three of the disabilities also need parents involvement. Okay, because this is crucial, it's very important collaboration that have to make it plan. Okay, task analysis. Um, for cerebral palsy, full physical prompt or partially prompt before teaching the child to do it badly. Depends the severity of the child. Okay. Positioning the child, example bathing using a bathtub, chair and rails rubber mat. Right. Okay. Parents involved also. Then Down syndrome, self analysis, visual schedule, video modeling, social story, play. Same with okay. All right. So thank you so much. And this is the difficulties, confusion, different type of method, it, communicating activities, modification, except in have to create routine for the child, use a picture and video. Many of them are visual. They can learn if see the video. Okay, so thank you so much. All the slides that presented. Can can you send the slide to organizer, maybe to Miss Mastura, so that we can share the slide to all participants. Finish this topic. Okay? Thank you so much. Okay. Let us start with our topic today. As I said yesterday, comprehensive sexuality education is the broad. Okay? So many components involved in education. But these 2 days, today and tomorrow, I will emphasize on a personal safety. Okay. And personal safety, send children personal safety is about private and public. Okay. Personal safety. I'm going to discuss about what to teach about private and public, including private and public place, behavior or activities, private and public body part, communication and conversation. Okay. Why to teach about private and public, and know the right place and conversation in the right place. How to teach about private and public. Right. Okay. Let us look at the first slide for today's topic. Okay. Private, definition of private is belonging to you, and public defined as concerning the people as public or private is not clear now. It has to be taught, especially for children with needs. It's quite abstract, public or private, but abstract or vocabulary for them. They need to know public places and private in home as well as outside home. They need to know, for example, that only when the door is closed, is a room considered private place, and this includes okay, it's a private place. Our room is a private place if the door is as toilet. Okay. They also have to be taught difference between behavior, private behavior. They need to be taught appropriate behavior in public and private places. Parents, okay, and caregiver need to specify what cannot be done in public. When teaching about topic private and public, parents and caregivers need to repeat things that have been taught in the session with continuity. Keep on repeating about the things that they had learned about body part, okay, public private body parts. So the children need to be taught good manners, especially example knocking the door and getting permission before entering another person's room. Okay. Not to just entering the room without permission. This is also one of the manner that Muslim family Muslim have this safety. Okay. All right. The objective for this public and private, so that they can differentiate between what is public, what is private, understand the importance of privacy in relation to others, privacy to themselves and privacy to well. What to teach? What to teach? Still same. Okay, we teach as early as possible, especially for the parents. Okay, use opportunity. Okay, as you can see just now, many of us use modeling. Okay, but by modeling appropriate behavior in the appropriate way by reinforcing information. So what is public and private play? This is the thing that we can tell the child understand what is public and what is private. Simple words, okay? Is a public is the room open, people can come and go easily. Everybody can go. People wear their clothes in the public. Nobody should open their clothes in public. In public place, you do not look or touch other others, people private part. Do not look or touch your own private part. Okay? Shops are a public place. Meaning that we can emphasize always emphasize the parents bring the child to the shop, emphasize that it is public place. You cannot do this, you cannot do this, that, so that they know shop is the public place that certain behavior can be done in public place. A private place is a room with the part where you can take your clothes off. Okay? In private place, you can look at and touch your private part. Your bedroom is a private place where the keyword is door open and door shut. So we want to use a picture, you should emphasize the door. Put the door closed as the is public and which is private. Okay. This is the activities that suggested by the Ministry of Health. How we want SEN to understand the difference between public and private place. Okay, first, we need to explain and discuss what it means. We should consistent telling them that private place is where you can be by yourself. For example, you alone in your bedroom or bathroom. That's private place. Explain that when you are in a private place, you can take off your clothes and dress up. Okay? And you can look and touch your private part in this private place. For example, the toilet. Okay? And besides that, the door must be closed for a room to be called a private place. This includes picture, okay, visual cues, show pictures of public and private places. Explain that what private place means. This is a very good tools that you use to explain. Okay, of course, modeling is the best, but we want to show a few places that to differentiate what is private and is public. We can use pictures. You can say public place is where you are with other people public means you are not alone. Okay, you are not alone. You are with others. All right. In that the first step is we should explain what is the meaning of public and private. Okay. Then public is a room with the door open. Okay. Ask the child to sort out flashcard. We can use also flashcard. Flashcard. A few pictures about public and private places. Risk. Okay. Facilitator just can place the flashcard saying private and flashcard in public. This is private. This is public. Apart from each other. Ask the child to place appropriate flashcard under the two heading private and public. Okay. You can use pictures from magazine. From magazines, then you can ask them to put pictures accordingly. Okay, then you enforce this is a public of pictures of bedroom. In the bedroom, the door is shut and kick off. Meaning that we can repeat it every time. We show the picture, we say that it's a private place, what you do, what you cannot do. Okay, then put the pictures of the bathroom below the private part. Do the same for that is the example for activities. Then we can when, uh, and, teach them how to differentiate between public and private. Okay, then next, ask the child and communicate with you. Ask the child understand. Ask them reason for choosing either the public or private. You can ask such questions. Can a person take off their clothes here? You show that. Can you take off your clothes here? Check. Then background is a public place. Okay, ask child. Then you also can give a worksheet. The teacher, we worksheet. Okay. But you can put many of pictures inside. Okay. Ask them to curl private or public places. Can do that. Okay, next, not to take parents. You can use this opportunity to teach about different types of sports. Also talk about different areas, including sport, swimming, prayer all the time. Private part must be covered. Okay, must be covered. You can end session by saying places can be private. That incidental learning we should practice incidental learning all the time. We have opportunity to teach about body parts and also about private places. So we are trying to do one activity. Activity one, I have a few pictures here. I took a few pictures of it. Okay, I want you to name this place. And tell is this place private, public, private, and why you said this is public? Why you said this is private? What can you do in this place? What can't you do? Okay, you can do a simulation and call another person, the friend, so that your friend can answer the question. Okay, we practice how we want to carry out this topic, and we teach the private. Okay, all right. The first five question. Okay, okay. This is the first. Okay, anybody want to try? I have got name, You can call another friend that maybe assume your friend 10 children. Okay, we do simulation here. So, okay, then I call Abdal. Madharhara. Can you call anyone of your friend? Please.
Hello, madam. Yes, about what, doctor?
Okay. Absal. Oh, thank you so much. Okay, Absal, you want to call one of your friends, the children? We do simulation, okay? Okay, you ask the 5 questions. Name.
Uh,
Okay. Who you want to call? Anybody? Call.
Hello, Mom. Good morning.
Name.
This is Cherry Kanda from Philippines.
Cherry Candle. Okay.
The place is public. It's a kitchen, and anybody. It's public because anybody can come in and come out anytime. We can cook here. We can eat, but we cannot take off our clothes here and dress or undress. Thank you, Mom.
Okay. Okay, you do it. You just present it. Okay. Okay, it's alright. Okay, I want somebody to do simulation. You ask your grandchildren, what is this? What picture is this? Okay, teacher. Okay, the second picture. Move to the second picture. Anybody? Okay, never mind lah. I be the teacher. Okay, I ask Absal again. Absal, what picture is this?
This is a public bus.
Bus.
Yes, doctor. Sorry,
Okay,
my
good.
line is not clear.
Oh, right. Is this a public or private place?
This is private.
Is it private? Transportation?
Private place.
Okay. Okay, why you say this is a private place? Public, sorry. Why you say it is a public place? Line problem, I think.
Hello.
Hello? Okay, I'm sorry.
I'm sorry. This is the public.
Public transportation is okay. Why this public place? Why you say it's public
Because
place?
the people can come in and out from this bus.
Okay, in and out. So many people. Okay. What can you do inside the bus in public place?
Just sit down inside and then
Sit down
yeah,
and chatting with your
and
friend.
can talking with others people inside the bus.
Okay, talking with others. What you cannot do inside the public transportation. After what you cannot do inside the public transportation, public place, you cannot do.
Hello, doctor.
Okay.
The other cannot touch the sensitive of the body.
Okay. Cannot touch private part, your private part. Cannot touch.
Yes.
Yeah. Okay. So
Then don't open the clothes.
don't open clothes. And this is the simulation that you can do with that in school. Thank you, Abba. Okay, okay, I can see here a few response. Okay, but okay, thank you so much. The response. Okay, we go to the next. All right. Anybody? Please, two person from one country.
Good morning. I'm
Maybe from
Rhea
Malaysia.
Lizada from
Morning.
the Philippines. I'm from the Philippines.
Okay, from. Okay, thank you.
Yes.
Ria.
This one, children, what is this place? Is this a private or a public place? When the kids would say it's a public place, why do you think it's a public place? Where do you think it is? Is it in our canteen or what? Or in a restaurant? Or it's in our cafeteria? When the kids would say it's like a cafeteria, I would ask, what do you do usually in the cafeteria or in the canteen? They would say they would eat, they would talk, they would buy things so that they can be fed. And then after that, what do you think are the proper ways that you can do in the cafeteria? And when the students would say, you will sit down, eat with friends or eat alone, and then you have to make sure that you have your clothes on, and you will not be touching anybody else, especially their private parts or their or your own self. You are not supposed to touch that because it is a public place, and what the proper etiquette or the proper thing that you should do in that place is just eat and talk.
Okay, thank you so much, Ria. Yeah, very good. Okay, at first we ask them what is name of the place. Okay, we can vocabulary of that new vocabulary maybe that the first time they went there, the restaurant or hotel or anywhere. So we ask name of that place. Okay, or in your answer just now, you the cafeteria after the sense state cafeteria after that, right?
Yes,
Yeah, canteen or cafeteria. Okay. Okay. Yeah. All right. From the three examples, we communicate with the child, right? What about child that less communication or cannot communicate as verbal? How we want to get the response from that? They can see. They are not blind. They can see. They can see that the pictures here, tables, and a few people see. Yeah. But how we want to get the response from the child that don't have communication, less communication? Anybody?
Dokter, Assalamualaikum.
Yeah. Salam.
I'm Rosanna from Terengganu, Malaysia.
Okay.
Okay. Normally, for students with speech delay, I show them a few pictures. For example, from this picture in a cafeteria, so we can show a few activities that normally people do at the cafeteria or a food court. I show a picture
Yeah.
of people eating, something like that. Picture of maybe the children take off their clothes. Then I ask the children that with speech delay, either the activity can be done in the public area, public place or private place by
Yeah.
showing them a few pictures. And
Yeah.
then that's all.
Right. Thank you, Marzana. That's the way. Okay. Because the most important thing is they can understand. So the understanding can showed by they put the right picture in the right place. Okay, the right activities, the good activities in the proper place. What activity can be done in the cafeteria and what activity cannot be done in the cafeteria. Okay, thank you. Okay. All right. Okay. There are a few of picture here. Okay. So how about this? Is this private or public place?
Private area. Private
This is
area.
private area.
Private area. What is that? What is indicator of private area here? Yes. I read the chat response because the door was closed. Okay. Then we can compare. You can use the same picture, but another picture show that bedroom is not a private place at that time when the door. Okay, so you can use the same picture. All. How about this? How about is it public or private area?
This is a public area.
Public area.
Public. Why?
This is a public area. Everybody
Public.
can be this place.
Yeah, everybody can go in and go out. So many because
Yeah.
as you can see here, nobody can nobody in the picture. So maybe
Nobody.
the person can do their own private activity here. So we cannot do our private activity because this is okay. Okay. All right. We move to the response. We move to the public and private behavior. Okay. Private behavior, doing things by yourself and keeping things to yourself. Public behavior, being with other people or doing things with others. Right. Okay. Then how to understand the difference between public and private behavior? This is the question. So, same as the now, explain and discuss example of public behavior. Tell the child that public behavior are activities that are carried out with other people. Ask the child to give example of activities, not send themselves, but with other people during eating, playing, shopping, or watching television. Okay? That is behavior that public. Okay? Then explain and discuss example of private behavior. Discuss what makes this behavior private. Okay? And tell the child that private behaviors are things that they do by themselves. Ask the child give some example of private behavior. Okay? going to the toilet, being closed. Okay, next, ask child to sort out this activity and the child to sort out flashcards into public and private behavior. Okay. Similar to activity on place, ask child to sort. Okay. Same as yeah. You can get many pictures of behavior that do can and cannot do in places. Right? Okay. Activity 2. There are 3 questions that need to be answered in also picture. After this, I show you picture. Name is behavior. And is this behavior public or private? Why? All right. Okay. Let me call Aisha. Aisha is from here or Indonesia? Aisha? Uh, okay, Aisha.
Okay.
The question.
Hello. Okay.
Okay, hello.
Yeah. I'm here.
Okay.
Hello.
Using the picture,
Yeah.
name this behavior. Is this public or private behavior? Why? Okay. Shift to the first activity. It seems that we do this activity with our 10 children. Okay. What is this behavior?
Which one?
This.
Okay. Okay, we can ask our yeah.
Okay, name of the
name of the place. Okay, this is a playground.
behavior. Sorry. Behavior.
Playground. Playing that one playing football or celebrating yeah. Playing football and yeah, takraw. Playing takraw. And the other one is celebrating birthday.
Okay, celebrating birthday. Party. Okay.
What's that question?
Okay, is it public or private behavior?
It's a public behavior.
Why you say that?
Because it's involved more than one person, and more than one person can enter the place. Yeah. And then this student cannot take off their clothes. Yeah. And for the other activity, celebrating birthday, there are also lots of people, so they have to what do you call? They have to what do we call? Okay. Okay, when we socialize with people, we have to make sure that our behavior will not cause the other people uncomfortable, such as take off the clothes and maybe what do we call? Okay.
Yeah, I know, because this is the answer from teachers, right? So it's quite long explanation for the teachers. We expect the expected answer from our SEN child is we cannot take out our clothes. We
in
cannot.
public.
Why? Because why we said this is public behavior?
Because it involves more than one people. It's a lot of people. And when we misbehave, people will not like us. And maybe and then other people will will will
Like
yeah what do we call it?
Feel not comfortable.
Will not feeling comfortable with us, and maybe they run away from us.
Run away from us.
Thank
you. Thank you.
Yeah.
A long explanation actually. Yeah, teachers, normally teachers we ask one question, they can answer about 20 words. Okay. The next picture.
Sorry.
Next picture. What behavior it is? Anybody want to try? Dang Nguyen from Vietnam.
Yes. Good morning, everyone.
Morning.
Yes, I'm Dan Nguyễn Quốc Kinh in the National Center for Special Education in Vietnam.
Oh,
and
okay.
yes, and for sharing my experience, in 2 years ago, I did a survey on 192 children with autism and intellectual disabilities on sex education for them. And we also develop instructional books for teachers and parents. So in my point of view, this is the private place, because the first thing is number of people in this these pictures is more than one. Yeah, and second thing is the this is opening areas, so many people can go and go on and go off. Yeah, that's my answer.
Okay. Okay, thank you, Mr. Dan Nguyen. Okay. This is a public, public behavior. Public behavior. Know that singing is the public behavior because in front of so many people. Okay. It's also public behavior, eating, the service maybe friend. Okay, so many people involved. Right? Okay. How about this picture? Picture. Okay, that's picture. Yeah. What behavior is it?
They change their clothes and take a bath.
Bath. They change clothes.
Yes.
And is it a private or public?
Behavior.
Yeah.
Yes. Because they can do when they are alone. So it's a private behavior.
Because okay, they do the activity. Okay, and this is a private behavior.
Yes.
All right. Okay. So we move to next topic and private. Okay. All right. Certain conversation should be kept to yourself or get certain people. Public conversation, conversation topic which can be shared with people. Okay. Talking things about that can be taught in public and private. What can be taught in public and private? We explain and discuss example of things that can be taught in public. For example, food, play that is in public. Okay. Use role play to help child practice. Okay. Role play also one of the methods in teaching sexual education. Explain and discuss example of things that talk in private. Discuss what makes it private. It's also important to know whom you can talk to about private things like going to toilet. Everyone is happy to private things. So uh, uh, we're going to discuss materials that can use in teaching this part. Okay. What is the material that we can use to teach about conversation, public and private? Anybody can give examples or can tell us about this? One?
Hello, doctor.
Hello?
Hello.
Hello? Yeah?
Excuse me. Can you click on the slideshow on the bottom bar, please?
Slideshow. You cannot see the slide.
Yeah. I can't see clearly.
Okay. Is
Oh,
it okay
thank
now?
you.
All right. Okay. This is about conversation, public and the private conversation. Okay. How we want to teach our SEN child what is public and what is private conversation? How we going to same as the method that we just went through, okay, what the private and public status, okay, then explain and discuss example. We discuss example, what should we talk about food, we talk about play, we talk about homework, we can talk, that is the conversation that that is a public conversation that we can talk with our friends. So many people can be there while we talking about food, about game, about homework. Okay, and but explain and discuss example of things that we talk in private. Okay, we can use post pictures to do maybe we can use pictures from magazine. Also, it's the same method. Talk about, you maybe show the pictures about uh, getting a period, or maybe about going to the cinema. Then ask the child to put the pictures which is the conversation, public conversation, and which is the private conversation. Okay, so that they can differentiate. And when we want to talk about the private conversation, we cannot talk private conversation inside the public. Okay, so the material also we can use same material for, yeah, we can use pictures, we can use what other things that and picture we can We can also do some simulation or demonstration, okay, so that they can practice the right conversation, the right. Correct. Okay, it is also public and private things that that very important to teach to SEN, not private part. Okay, in order for children to acquire a healthy attitude toward sex, parents and trainers must be willing to provide correct knowledge on body part of body, including the sex organ. This is more important in children with disabilities, as sometimes they have no sense of control of their body as they are accustomed to other people handling their body. Okay, this is we also discussed yesterday the cerebral child that need somebody to handle their cleaning activities and so on. Okay. The objective is to make children understand the function of their bodies, okay, so that they know what is the function of ear, eyes, what is in the public body part and also the private part. Yeah? They should recognize body parts that are private so as to ensure appropriate behavior and prevent abuse. Okay? We need to let them understand that body we have is ours. And one of us needs to respect, protect, and be responsible for our own body. Okay? It's also important to be able to explain to the child with special needs about babies and where they come from. Everyone needs to have access to accurate information to know how our body works, and to know about reproduction. As I remember yesterday that I share with you the slide, what to teach according to age, what's appropriate age to teach body part or emotion. Okay. Children are often curious and need to find ways to respond to their understand what is being asked and why, then answer. Okay. So teachers should feel comfortable, okay, and more skillful and know how to handle when it's occurred. And depending on their age and ability to understand and may have simplify content. Okay, we have to simplify our explanation to them. Why it is public? Because so many people. Because it's you alone here. Because door is locked. Because for it's a private. It is private. You do something with your private part. So you need to do it private. You should emphasize and simplify the question, the answer that you are giving to the child. Okay. Public and private body part. People can see your part. Okay. Head and shoulder, knee and toes. All those part. Private parts. People cannot see your private part. You as also cannot see other private body part. Touch your own private body part unless when you need to clean your private part. Okay. Okay. So this is the suggestion. We are going to teach about private public part. The first one is explain that people are born either male or female. Males and female, boys and girls have some body parts that are the same and some that are different. Because boy also have to know the body part, private part of the girl. Same goes to the girl. Same goes to the boy, so that the boy can have to teach about what is the private part for the girl. Okay, because boy become a man one day and the girl will become a woman. That child naming body part, including private part, using proper terminology. Yesterday, example, penis, vagina, and function as well. Yeah? Because because can also have right, the right terminology and the right function of their private parts. Then they can name the body parts using their own body part. Okay, they can show the body part and name the body part themselves, or they can anatomically correct doll. Correct doll meaning that all the body parts has we can see all the body parts in the doll. Okay, or we can use on diagram pictures, diagram, a boy, a girl, puppy, and body part. Okay. Discuss about the function of different parts. Explore, so notes for the trainer. Explore the words or term used for different parts. However, stress on character. Yeah. Use opportunity to teach when assisting in personal hygiene, bathing, cleaning, or dressing. Okay. I want to share about the correct anatomically correct doll, because in the module life safe training, we have a quite complete body part of a doll. We can see the vagina, we can see the breast, and we can also pull fetus or babies inside the womb of the dog. Okay, but hard to find that type of doll. Can use diagram, and you can also use what we see if you want to use what you use if you want to cook. I forgot the apron, is it? Apron. Okay. You also can use apron. Okay, the teacher, if you want to teach own body, you can use apron. On the apron, can draw breast and draw the reproductive organ, okay, and then show what is the name organ. Okay, right? There's so many teacher can use their creativity in creating things to teach as teaching aid. Okay, teaching aid, teaching body part. Okay. Then also able to name male and female body parts of and describe their function. Okay. Gather pictures of men, women, boys, and girls from magazine, paste in workbook. This is one activity that teacher can do. Maybe also we can do some like life cycle. Okay, you can use pictures to describe about life cycle also. Infant and a baby, children, teenagers, adult, men and men, girls and boys based in the then ask child to name body parts and describe its function because the body parts for a child is the name of the primary sexual body part, sexual organ. In that we just can say that for a baby they have testes or penis. For girls they have um, vulva. Okay? But when we teach body parts for teenagers, for adults, we are going to give new terminology for the body parts of a man, of a woman. You can see what breast, okay? Maybe compare breast during child and breast when it's matured. In teenagers, breast. Okay? The most important things when we teach parts, sometimes we feel again we feel comfortable without we feel shame or shy. So we have to develop confidence of and we have to be comfortable to say that okay. But again, when we teach part, we apply the what I did yesterday that with the low tone, okay, when and not shout when say but because anybody in the diagram or okay, ask which parts are the same for male and female, okay, so that they know that they can differentiate between male and female. There is body parts that same whether you are a male or you are a female, and that is called a public body part. Okay, eye, ear, right, mouth. Okay, but mouth, because of the tendency, mouth become the body part that abuse. Okay, but we have to emphasize also that mouth also is a private body part. You agree with me? We also should emphasize that mouth also private part. Agree. Why? Not agree or agree? Hello? Aida, are you agree if I say that mouth also private body part? Yeah.
Doctor, I do agree with you. I do agree with you that the mouth is also a private part
Yeah.
because sometimes it is being abused. Um,
I can
let me share. Let me share a little bit of a story
yeah.
regarding my students. I'm handling deaf, blind students, students with autism, children with learning disabilities. Um, Early part of my teaching, I was approached by my student. They're male students, and they approached me that when they were in a public restroom, they were forced by a gay person. Since they cannot talk, they cannot express themselves. They were forced to uh, to kiss the private part of that gay person, and they asked me if it was abuse or not. And it was early part of my teaching, and I cried. I went out first and I cried, and I told, when I went back, when I was sober, I told them it was really abuse, because you are not supposed to do that, especially that they are strangers, and you were the weak one. And I told them, what happened to you? What did you do? What how it happened? And they told me that there were other people, they were bigger than them, and they were forced to do that in a public restroom. And so I told them, the next time that you are being blocked, you create sounds so that the guard outside of the restroom could help you out. And it was really sad, and I really have to do some psychological intervention for them, because it was something that was scary, it was something that was strange, and it was something that opened them to a lot of bad things. And and I really do agree that, the mouth is really not just for eating, but it is also something that you should take care of.
Yeah. Thank you, Ria, for sharing the experience, but I cannot hear the whole story of that you have shared. But I see the children, the deaf student, is it? Deaf
Yes,
student?
yes,
The,
doctor. Yes,
okay,
deaf.
the deaf student tell you what happened. Okay. So
Yes.
mouth is also, we have to consider that mouth is also private part. Nobody can put the thing that we don't want to put in our mouth, or our other private part also cannot put inside our mouth. Okay, and we can say no if someone tries to put things that we don't want to put inside our mouth. Okay, so yeah, because that happen also here, and we have to educate before. This mouth is not considered as private part. Because of
Yes.
so many things happen nowadays, we should
Yes.
educate our SEN children that also have to take care of their mouth. Then
Yes.
maybe we can have activities such as we draw a box, like what cartoon with mouth. Okay, then we can do activities. Maybe we can take a picture of sandwich or bread. Can take a picture of reproductive organs, and we can take care of anything. Then we ask the SEN child to put inside the mouth, whether this is good to put inside your mouth or no good to put inside your mouth, so that they know that how to differentiate what is good and what not good, and put something inside their mouth. Okay, thank you for sharing, Ria or Ria?
Ria.
Ria. Okay.
Thank you, doctor.
Okay. All right. They are also able to match and label the male and female body part. Okay, so no taboo here. So male also can male also can know what is female body part. They have to know what part. So this is time to educate them, so they know both of uh, the male female have their own parts. Right. We can use flashcard or diagram. Okay. That's why I emphasize of if we use diagram, we do it in a proper, not laughing. We seriously teach about the okay. Ask child to match a level. Ask if they know which part they can so they can analyze what is the same, what is similar, and what is different with a boy and girl. And also the function. Function also when it's time to tell them into their age, ready to teach them. We have them. What is the function of the private parts? Okay. Next, know the difference between public and private. Okay. Anatomical doll. Private means keep out or don't touch. This is my private. Don't touch my private thing. This is my private body part. Don't get our private parts are so special and keep them covered up. Most of keep on emphasize that our body parts, our private parts, so special. We ourselves have to cover it up most of the time. Have to take good care. Keep on. Okay. Explain to the child that everybody has private parts. Again, people should not see your private parts. Private parts. People should not see other private parts. People's private part and not people's private part. Both parties. Explain to the child that private part can only be seen or touched for certain reason. Okay. So, medicine. Okay. So maybe you have um, um, uh, on your doctor or mother can touch penis, put medicine, put medicine, or to help clean private parts. For children need it. You also can ask children to draw. Draw. We can give them a diagram or a girl. Then we can ask them to put clothes, proper clothes to the diagram, boy and girl. Put underwear first, and put clothes onto. Okay, this is also the time that we can emphasize. We can teach the proper attire. Okay, the proper attire. Now it's time to go to bed. Okay, what is proper attire that should we use? We ask them to put what cover. We ask them why you cover this part. Okay, we hear from the child why they covered the breast. They're going to say this is my private part. Why you want to cover it? Okay, because it's so special to me. I'm the one of my but okay. So let's stop. All right. Emphasize on the private body parts. Explain that females can have certain body parts that are special and private, such as breast, vagina, vulva, and okay. And explain males have certain body parts that are special and private, as testicle, penis, and again using diagram of male and female here, guide how private part of both sex. Okay. this is a bit note, cases of sexual abuse. We discussed now about mouth, private part. I focus on oral sex. I forgot the terminology oral sex. Okay, oral sex are increasing at this now. Therefore, it is important to consider even the mouth as I explain to the child that our mouth is used talking, eating, and drinking. Only certain things are allowed to put in the mouth. For example, food, medicine, or right? No something in the mouth. No one is allowed to kiss you if you don't want to kiss. Okay, this is things that we have to tell the parents. They should, they have right to say no. All right. I think I finished my slide about this topic. Okay. So, is there any question? Is there anything that you want to share? Your experience about public and private places?
Doctor, can you
Yes.
please back to the slide before, not to the trainer?
Time?
Yes.
Okay.
Okay, wait. Okay, I want to take note.
You want
Thank
to
you.
take note?
Yes.
I'm going to share this slide to organizer.
Oh, I see. Thank you very much, Doctor.
They will give you all of the previous.
Thank you very much, Doctor.
Okay. Anyone? I think I want to hear from Brunei how you practice your sexual education, sexuality education for STEM children in Brunei. Because this is also a very good platform. Can share our good practice among. Maybe after this we can share from Mr. Dan Nguyen from Vietnam also. Or Mr. Dan Nguyen, can you share with us how the practices of sexuality education in Vietnam? Or anybody? Aliza, Mr. Aliza.
Assalamualaikum. Yeah, Assalamualaikum. I'm teaching a primary student, so I don't have any idea on this sexuality. I don't have any idea on this. This is my first time to have this course.
Okay.
So what we do in school, we have a student with most of my student in my primary school, most of them are speech and autism, and they are using Pampers. So what I did, I just trained them how to get rid the Pampers, and it take about 2-3 years to do that. So that is the only way I can teach the way on the get rid the Pampers. But at this moment, I don't have any idea on that teaching the sexuality. Now I know how to teach this later when they come across. I mean, when they they are more matured. So that's I can share about my my student in my school. So in terms of sharing pictures, is it okay if we shape the real picture of the private part to this age of students? What do you think?
Okay, I open the floor. What do you think if you normally you use a diagram picture also can, okay?
Yeah, diapers, yes, okay, but the real picture of the private things.
Yeah, the real
Do I
picture.
have to explain to this student because they are no mature, they're still very young, so I'm afraid that the parents will say about this thing. So it's a bit complicated for me to share with this to the parents.
Yeah, yeah. Yeah, I understand your situation. Okay, that is why, because it is still not open, parents especially not open to teach about sexuality. Okay, still taboo for many people. Especially if we want to call the name of the private part, okay, is still malu-malu nak cakap kan, hard to say the proper word. Okay, that's why people feel comfortable to name the private part as a slang name.
Yeah.
Bird, yeah. But
They will say burung like that.
burung. Then
Yeah.
we have to stop it because we are considered professional, professional, and we teach the child as professional. If not, the child will going to explore themselves from many other sources outside. From internet, they will explore internet, they can see the real picture of penis, breast, and all those private parts. Okay, so which one you want to choose? They themselves to explore, themselves, or we as a teacher guide. This is a private part we call penis. We have to, that's why we have to train ourselves to be comfortable, but it's not easy to be comfortable with something that we can. We have
So
to
we
train
have to teach them in our own language, Malay, or is it better in English?
It depends on the children. Because sometimes it's easier to say it in English word, breast, rather than in Malay we call payudara. It's a
Yeah, it's a
long word,
standard.
right?
Yeah.
Better with breast. Okay. And penis easier. Like girl. Okay. That's why we start from as early as possible. As we said just now, if parents not angry with the parents angry with the teachers, we teach all those private. Okay, but first, if you want to implement this in school, parents is the first person we have to educate. We have to educate parents. Okay, we can maybe we want to do our activity, what healthy life, live life, stay safe in our school. Okay, that is our program in school. So we invite parents to come in our meeting, and when we show them what we are going to teach their children.
One more thing,
Yeah.
I got a question about regarding the toilet, public toilet. When in school we teach about the bowl toilet, there are some private place they have a squat toilet. So this is a difficulty for the parent to do this one in with the child. So what do you think is the do we have to teach both the toilet and the squat toilet to the children? Because it's so complicated for them to understand. What do you think?
Okay. Any other opinions about this? Squatting toilet or sitting pool? Sitting toilet. Because sometimes at home, maybe parents don't have the sitting toilet, right? They have the squatting toilet. Okay. Okay, for me, in my opinion, we have to teach both, especially in the primary school. For primary school, if we see that the child, okay, let's say the Down syndrome boy is physically okay, can squatting, okay, then we can teach the child to use the squatting toilet. Okay, then if he mastered to use the squatting toilet, and maybe we can also teach him to use the sitting toilet. Because as you said now, if we go somewhere else, that big toilet have the squatting one, just the sitting one, so that's why many people who not use to sit in the toilet on the toilet bowl, they will squatting on the toilet bowl, right?
Yeah.
There's so many sitters that don't squat inside in the toilet. Okay, so we have to teach both. Okay, unlike as we see that the child is physically unable to teach the, okay, because we as a teacher, we should explore everything that the child can do.
Okay.
If we notice that at the end they cannot sit, then we use the sit.
Okay, that's all from Brunei.
Okay, thank you
Thank
so
you.
much. Okay, maybe Brunei can start thinking of sexuality education, or maybe reproductive health, okay, or maybe some program to
Maybe
educate
please.
them about this.
Yeah, my case is primary school only. I don't know what with my friends in the menengah school.
Okay, so primary school, that is the very crucial time actually for us to teach everything is primary school.
Yeah, we will deal with that later. Thank you.
Inshallah. So any other doubt or anything to share about the progress of sexuality education in your country? I love to call Mr. Dan Nguyen. Okay, maybe tomorrow, because we wrap our video conference, maybe we can share that now how sexuality education carried out there. Okay. Right, I think I'm going to end this lecture. I hope the four aspects of private and public that I said just now will be benefited by all of you, and inshallah we are going to implement. Okay, you meet tomorrow for the last, right? Okay, thank you so much.